Thank you so much, Jill. One of the things that I'm aware of from the National ALS Research Program is that Jill is one of a small group of staff that shepherd the funds that you raise through the Walk to Defeat ALS and through other chapter and national fundraising programs. They're the tip of the iceberg that leads to literally hundreds and hundreds of other people working diligently towards finding treatments for ALS. And so one of the things that she highlighted very much are the basic science as well as translational research pieces of ALS that the program funds. But another important piece of ALS research is looking not only at the mechanism of the disease, which has to do with motor neurons, the central and peripheral nervous system and their interaction with muscles, but also looking at what environmental factors may be part of the cause of ALS, and the knowledge that we glean from that information that leads us to understand the disease and to look for ways to find new therapies for the disease, but also hopefully to find a way to someday in the future prevent ALS, which would be one of our longest term goals. One of the ways that the ALS Association and you as a community are part of this effort is through public policy efforts. Many of you may have signed up through our website to be advocates for public policy issues that happen in Washington, D.C. and in Congress. Well, through efforts of the ALS Association and other community stakeholders, but primarily through people with ALS saying it's important to make a difference, for many years up on Capitol Hill, at National ALS Public Policy Conference and Advocacy Day in Washington, D.C., we scour the Senate and House office buildings and meet with our senators and congressmen to get them to fund both basic science research, but also a very important project that was founded in 2008 to help create and eventually fund the operation of the National ALS Registry. And we're privileged today to have with us Dr. Paul Mehta, who is the principal investigator for the National ALS Registry. He's traveled to be with us today from Atlanta, Georgia. He's prepping to go home to make sure his house does not wash away from rain from the hurricane that eventually will move his direction. But he is both a family practice clinician, but also decided to move his career in the direction of public health, and has been the principal investigator for the National ALS Registry for the last 4 years. So please join me in welcoming Dr. Paul Mehta.
So very good. So I'll be talking about the second report, which is already published, and our third report, which is also coming out. Our surveys, our notification mechanism, how we go ahead and help researchers and connect with patients for clinical trials and epi studies, our publications, as well as the National ALS Biorepository, the research we fund, as well as our public health grant rounds that took place this past April, our activities for 2017, as well as a registry video that we also have, and any questions after that. So I think it's very important first to realize that we do a lot more than just count cases. We're a small group, we're a cohesive group, but we do a lot more than just looking at the incidence and prevalence of ALS. We have the National ALS Biorepository, which just launched this past January, which I'll discuss. We do the epi side, looking at new cases of ALS, existing cases of ALS, the incidence prevalence in the U.S., as well as we work with partners very, very closely, the ALS Association National Office, as well as the local chapters as well, such as this chapter. Our survey data, our notification system, how we go ahead and help patients get information about clinical trials and epi studies, and more importantly, the research we fund. Research certainly is a very, very important part of research to find out what causes ALS, and so for us, we look at the etiology, that is what potentially may cause this disease. And more importantly, ALS research counts on you. So that's certainly something we want to kind of take home. This is your registry. I'm a caretaker of this registry, and so it's very important, to be involved in this registry. So Lance mentioned the fact that there was a concerted effort back in the 2000s from the ALS Association and patients and caregivers about having their own registry. And so Congress back in October 2008 passed the ALS Registry Act, and that tasked CDC to go ahead and create a population-based ALS registry. It did not make ALS notifiable, and I'll get into that very, very shortly, what that actually means. So we launched back in October 2010, and the purpose of the registry are multifold. We look at the incidence of ALS, which is the new cases, prevalence, which are the existing cases at a particular point of time. We also look at the demographics, who gets this disease, as well as, more importantly, looking at the risk factors for ALS. This right here is the methodology about how we go about doing that. But before I get into this, let me just quickly tell you about ALS. When it comes to being in public health arena, there's something called notifiable and non-notifiable. Diseases such as like ALS are non-notifiable, meaning to say they're not reported at the state health department, which eventually comes to CDC. That gets into the realm of communicable and non-communicable diseases. So communicable meaning it's transmissible between a person, and non-communicable meaning to say it cannot be it's not transmissible from person to person. So ALS at this point is non-communicable as far as we know. And because of that, we have to go ahead and have a methodology or a mechanism to determine what the number of cases are in the United States. And so we have a methodology which we pilot tested, and it was proved to be effective. One of the questions you may be asking, well, if it's non-notifiable, can't we go ahead and change that, making it notifiable? Well, that certainly is a possibility, but when it comes to diseases like ALS, you will also have other pushback from folks in MS, Parkinson's, and Alzheimer's, and other diseases as well, which are not notifiable. And these days, the public health arena, the public health departments themselves at the state level, many of them are certainly, they're pressed for money, pressed for funds, and pressed for resources. So very quickly, this is the methodology for the registry. So we get our cases from a dual system or a two-pronged system. We get our cases from the national admin databases such as Medicare, Medicaid, and the VA system, as well as the online portal where we encourage patients to go ahead and come to the online portal, answer a series of questions, and go ahead and take our risk factor surveys. And from there, these two make up the National ALS Registry. So our cases are coming from individuals who are coming to the portal, as well as individuals who are already in existing databases such as Medicare, Medicaid, and the VA system. And what we do is to go ahead and figure out how they're a true ALS case. We'll look at, for example, ICD-9 classifications, which is a certain code they use behind the scenes to classify diseases. We'll go ahead and look at, is a person taking Riluzole or Rilutech? How many neurological visits they've actually had. And so we'll go ahead and take those variables and determine if a patient potentially has ALS, is a true patient, or does not have ALS. So our findings from our second report, which was published last year, so as of 2013, there were almost 16,000 cases of ALS in the US. And this comes out to 5 cases per 100,000 persons. So for whatever reason, ALS continues to be more common in whites, males, and persons between the ages of 60 and 69. The lowest number of ALS cases are those between the ages of 18 and 39, and the greatest after the age of 80. Males have a higher prevalence of ALS than females across all data sources. And that's one of the cruxes. We're not sure why ALS affects whites, and especially males, at a higher rate than other individuals. We are currently working on our third National ALS Prevalence Report that should be published within 2 months. That will cover calendar year 2014. And so that right there will cover, as in terms of, we'll also do something also unique with this one as well. We'll go ahead and have hospice data from Medicare, and which will be added to the actual algorithm itself. And our initial observations are that we're capturing more cases of ALS, and the prevalence is increasing, but it does not mean the number of ALS is increasing in the US. We're just improving our case ascertainment, as well as the use of the multidisciplinary clinics across the country. It's shown to be more effective as in terms of prolonging the life of ALS patients as well. You may be wondering, well, hey, you know what? You're saying 16,000 cases in 2013. Aren't you guys missing cases? Yes, we are missing cases, and those cases we are missing are from, for example, from private pay, from the HMOs such as Kaiser Permanente, from the major healthcare providers out there, where we're not getting that data yet from the private insurance companies. So, but that's something we're certainly working on to go ahead and get that data. The These are our risk factor surveys. Hopefully many of you are in the registry and have taken these surveys. We currently have 17 surveys, and these surveys range from demographics to occupational history, military, smoking, alcohol history. We also have disease progression, which mirrors ALS, FRS. It's a longitudinal survey where patients will take when they first come in, and they'll get reminders to go ahead and take them. We also have something called open-ended questions where patients can go ahead and tell us what they feel may have caused our disease. We also have pesticide use, exposure for caffeine consumption, as well as head and neck injuries too, which certainly, today when head and neck injuries, especially with CTE, which is chronic traumatic encephalopathy, in NFL players, that certainly is kind of taken off these days. So we're looking at all these risk factor surveys and trying to find any sort of common variables there. So we already published our first surveys 1 through 6, and what we found there was nearly half the survey respondents were ever smokers compared with 41% of the general population. The majority of the survey respondents were light drinkers, and then nearly 1/4 of our survey respondents were veterans when compared to the general population, which serves as about 9%. So we certainly had a higher number of individuals who are taking these surveys who are in the military. We also know for those who are served, for whatever reason, they're double the risk of getting ALS. We're also looking at analyzing survey 7, which is disease progression, like I mentioned. We're looking at surveys 15 and 17, looking at health status and clinical module. And I mentioned the open-ended surveys where you can go in there, you can tell us what you think may have caused your ALS, and that's also being analyzed as well. So my colleague Jill mentioned all the work the ALS Association is doing, to go ahead and promote clinical trials. In the registry itself, we also help researchers as well as institutions like these big pharma companies to go ahead and recruit for their clinical trials as well. So when a patient comes to the registry, they can opt in to receive information about clinical trials, and currently about 95% of individuals will go ahead and select this particular button to get information about clinical trials. And so what we think it's very, very important to go ahead and, our registry is the largest registry in the United States for ALS patients, and so we want to go ahead and leverage that and go ahead and have this information sent out to those who want information about clinical trials. There was also a recent document the FDA is working on where they're encouraging big pharma to use existing registries already out there for drug trials, only because if they're already out there, why go ahead and recreate the wheel when you can go ahead and use existing registries for particular drug trials. These right here, currently we have 29, and so the ones which are highlighted in red are clinical trials we've actually helped to recruit for. I'll quickly just go through this right here. The ones I want to point out, I'll briefly go right here, so are the ones for cytokinetics. Jill mentioned the fact that they helped out with the tirasemtiv. We also helped to recruit for tirasemtiv as well. There's a drug called tirasemtiv. It looks to hopefully reduce muscle fatigue in ALS patients. We also helped to recruit MP001 Neuraltis, which is looking to help to slow down ALS inflammation. So these are certainly some of the ones we want to go. We've helped and partnered with big pharma to help them recruit for their clinical trials. Some of the notable epi studies we've actually helped is the ARREST ALS study out of Columbia University. We're looking at the relationship between oxidative stress and ALS, as well as Mass General's microbiome study, which is an assessment of the role of gut microbiota in the development of diseases such as ALS. The area of the microbiome actually has taken off in the past probably decade, where they're looking at gut bacteria, which I know it sounds really weird, but there's something as in terms of, they're looking at the bacteria in the gut and how that affects one's progression of disease or one's possibility of getting diseases and so forth. So it's all these intertwined mechanisms, whether it's the environment, whether it's yourself, whether it's genes, that kind of causes us to go ahead and look at and examine what causes ALS. I like to say there are more unknowns and knowns about ALS, but progress is being made to go ahead and make that, to go ahead and get the knowns out about ALS. We also helped recruit for the Barrow Neurological Institute ALS testing at home, so patients can go ahead and help, at their comfort of their home, go ahead and take surveys and help out, and go ahead and do some testing as well to go ahead and examine the functionality of their progress. We also do a lot of publications as well. So in 2017, we have over 10 peer-reviewed publications. All these are listed on our website. And this is kind of important. So these days in academia, when you want to read something, it's kind of behind a firewall. So what we try to do is we go ahead and buy open access to these journals. So you can come to our website and you can go ahead and click on a particular article and you can see exactly what's happening. We're also going to be revising this slightly and putting the full abstracts of all the ones we've helped to either fund or recruit for also available as well. So this is an important thing. National ALS Biorepository is now live. So the biorepository, we underwent a 4-year pilot study to determine the feasibility of the biorepository. We brought in experts from around the country to figure out, can we have a biorepository? And after the 4 years, it was deemed to be feasible. You may ask, well, why is a biorepository important? Well, for us, it can help find out many, many things. Jill mentioned biomarkers. We're looking at biomarkers as well. And this past January, we launched, and enrollment has begun. And if you're interested, if you're already in the registry and you joined, let's say, last year, you can go back in and you can go ahead and reconsent to go ahead and get information about the biorepository. If your password needs to be reset or you have information, just give us a call, send us an email. We'll be happy to help you out. We have a team who just answers calls to go ahead and assist caregivers and patients in any sort of password resets and so forth. Our annual sample collection goals, we're looking to have 675 in-home collections, 325 saliva, 325 comprised of saliva, urine, blood, 350 the saliva kits for those who don't want to give blood or those who are potentially, just don't want to. And we also have something called the Global Unique Identifier, which allows patients to enter some information in, and it gives them a global unique identifier where researchers can go ahead and track their progress from clinical trials or other studies which they may or may not be in across the country anonymously and securely. So our biorepository is going to be really unique compared to other biorepositories out there. So I showed you all those risk factor surveys. So all those risk factor surveys will be linked to patient information as well. So we'll have the epi data. We'll also have their samples as well, and those will be married together. Will also be nationally representative. So currently you have biorepositories or repositories which may collect samples based on a clinical trial. It could be limited to, let's say, a geographical location somewhere in the country. Ours will be coast to coast. So we'll be looking for patients to sign up in Oregon, Washington State, and everywhere else, coast to coast. It's user-friendly. We come to your home to go ahead and collect these samples. So our phlebotomist will go ahead and contact you. And more importantly, there's no charge. This is your biorepository, so we come to your home to go ahead and collect these specimens. We also have a postmortem component as well, where we're looking to collect 10 postmortems per year. And so our hope in the future is this, to make this the largest collection of ALS pristine samples. That means pristine samples which have not been used by anybody else, and they're available for researchers to go ahead and analyze in the future, and looking at areas such as genetics, biomarkers, and disease progression. We currently, for genetics, have partnered with the NIH to go ahead and do genotype testing, and they went ahead and took care of that for us. So they'll be the ones who will be doing the testing of all the various genes in the samples as well. This right here is a schematic of the actual biorepository itself, where you have the in-home collection of blood, urine, saliva, and the post-mortem collection of brain, bone, and so forth. And then you have the risk factor surveys, which are married to the biorepository, which gives us that rich information about the epi side. Was a person in the military? What occupation did that person have? Married with their actual specimens and samples themselves. And those specimens are then sent out to researchers for further analysis. So research is certainly the heart of what we want to do as well. I mean, extramural research funding is very, very important to figure out what causes ALS. And so currently we have 12 research studies. We'll be adding one more in a few weeks. We have something called a funding opportunity announcement, which was published, and it was applied for by researchers. And we're going to be making the award pretty soon. So we'll have 13 funded research grants. This right here is actually a list of everyone we've currently funded. Many of these are notable researchers in the area of ALS. And just to kind of highlight some of the research we're already funding, Dartmouth College is looking at potentially harmful algal blooms, cyanobacteria in lakes, and seeing if that potentially may cause or may be a risk factor for getting ALS. And they're looking for actually individuals living in northern and central Ohio, as well as for a previously funded study, individuals who were in Florida as well as Vermont. Stanford University is looking to see how chronic medical conditions and drugs may increase or decrease ALS, as for example, like looking at hyperlipidemia, use of statins, diabetes, autoimmune diseases, and so forth, to see if there's any sort of link to ALS. We're also working with an international partner called Trinity College in Dublin, and where we're looking to see, and what these guys are doing is, because the Hispanic population in the U.S. has a low rate of ALS, they want to go ahead and compare the populations of Cuba, Uruguay, and Chile to the population in Europe and see why potentially there's a risk for the Hispanic population for ALS when compared to the Europeans. So this past April, there was public health grand rounds at CDC, and public health grand rounds is a pretty big deal at CDC. Hopefully some of you guys watched it. If you didn't, you can always go back to our CDC's website, Public Health Grand Rounds, and you can go ahead and see the entire presentation that was done. And this was very, very important to kind of go ahead and bring attention to ALS. This was the first time ALS was ever at CDC's Public Health Grand Rounds, and so this certainly was something for us to kind of, bring, like I mentioned, bring attention to ALS. I spoke, Dr. Kevin Horton spoke, and we also had a neurologist, Dr. Ed Kasarskis from University of Kentucky. He also spoke as well. And more importantly, we had a couple of patients speak as well. We had Ed Tesaro, who gave the patient perspective, and then we also had Becky Kidd, who also had a separate interview about her experience as a patient. And so for us, it's, ALS is one of these things where I personally feel it doesn't get the attention that it needs. It should get more attention. So, we want to go ahead and increase awareness about ALS. Our viewer metrics, we had over 20,000 Facebook Live viewers at the time. The post reach was over 200,000, and the organic reaches are all metrics, or web metrics and so forth. But more importantly, this was a way for us to talk about ALS to a large group of researchers, public individuals, and highlight the importance of ALS. So for 2017, our activities, like I mentioned, we're going to be funding one more research grant. And research is always based upon the availability of funds when it comes to the government. If we have funds, we try to put it out for research, and hopefully in 2018 we'll have funds available to go ahead and have some more funding opportunity announcements out there for researchers to apply for. We'll be updating the registry's website. Right now, our website, to me, could be a lot better. We want to kind of clean it up, make it much more responsive, so you can actually see it easier on your phone. We'll be launching a Spanish version eventually as well. And we also have a new informational video, which I'll be playing shortly, which kind of gives us a synopsis about ALS and how ALS research is important and how it counts on you. We'll be getting out our third report on the national prevalence of ALS. That will be coming out shortly. And we're also looking at manuscripts. That's research papers currently in progress we're looking to get out as well. The first one's kind of important, access to care. So what we did was we went ahead and took all the prevalent cases in 2013, we mapped them out in the United States, and then we overlaid those with all the ALS Association clinics and the MDA clinics, which are the two largest providers, with the ALS Association being the largest, providing support for ALS patients. And so from there, initially what we're seeing is over 50% of patients live over 50 miles or more to the closest ALS clinic. So access to care certainly is very important. Individuals living in Montana, Wyoming, some of the rural states, the plain states, they may have to drive a lot further to get to an ALS clinic. So we want to kind of highlight that access to care is very important for these, for the care of ALS. We're also looking at, for example, capture recapture, which is a methodology where we can estimate the number of missing cases. I mentioned to you earlier that we're not getting all the cases from the private insurance. So this may allow us to simply say, hey, you're missing this percentage of cases from potentially the private sector. And then the open-ended surveys, we're also looking at how what people tell us what may have caused their ALS as well. And we're continuing to go ahead and look at all those risk factor surveys. We have almost 70,000 completed, and those go up pretty much on a weekly basis. So if you've not done so, I certainly would encourage you to please take those risk factor surveys. Those are important for us to get information about your, whether it's your family history of neurological conditions and so forth. So in summary, the National ALS Registry is your registry. We're the largest population-based registry in the U.S. for ALS. And we added the biorepository to make it a much better registry to go ahead and promote research. We added the GUID. We continue to go ahead and fund research, which I certainly feel is the heart of what we want to do, is to examine and look at what is causing this disease. We're going to hopefully have a larger internet presence on our website or on the web in general. And then, like I mentioned, the registry continues to mature. We're not just about counting cases. We're about a lot more. And for us, it's very, very important to highlight that. We fund research. We work with Big Pharma. We work with our partners, the ALS Association, to go ahead and raise awareness about ALS and have more participation in ALS and ownership in the registry itself. So this is a brief video which I'm going to go ahead and play. I think my colleague in the back will go ahead and activate it.
ALS research counts on you. For progress in ALS research, we need your help. You can help by sharing your data with the National ALS Registry. The National ALS Registry is the only research project of its kind. Data from the registry will be used to help us better understand risk factors for ALS. If more people with ALS join the registry, we can add to that knowledge. We are gathering information to help us learn what may cause ALS. Your data will be used to identify people in the U.S. with ALS, learn more about the characteristics of those with ALS, and better understand risk factors for ALS. How can you make a difference? You can take part by safely and securely sharing your information and taking the risk factor surveys. Finding out what may increase the risk of getting ALS could help guide research into the treatment and prevention of ALS. Patients can also use the registry to connect to other research studies and clinical trials. Turn ALS research into ALS progress. Learning more about people with ALS is critical to defeating it. Learn more about the National ALS Registry. Visit cdc.gov/ALS for more information.
Thank you. Sorry?
So Joe Beckman, if you can come forward, and while Joe sets up his computer, I want to ask you a couple questions.
Sure.
Can you talk a little bit about, since we have a lot of people online living with ALS who may be watching, and there's a number of people here in the room, what kind of is the actual step-by-step process for registering?
Sure.
And
Sure.
And how do you ease any barriers?
So obviously, you go to our website, cdc.gov/ALS, and from there there's buttons there called Join the Registry. You'll take a series of questions, just kind of confirming your diagnosis of ALS. For example, the neurologist diagnosed you with ALS and so forth. And from there, you will go ahead and answer these questions, and you'll be entered into the registry itself. There'll be an area where you'll go ahead and enter your information, your name, and so forth. And from there, after that, you can opt in for receiving information on notifications, more information on the biorepository, and so forth. And then from there, we'll take you to a dashboard where you can go ahead and take the risk factor surveys. If you have any questions, you can go ahead and contact us, email us, and we'll go ahead and be happy to help you out, whether it's getting registered or whether it's resetting your password and so forth.